afternoon and welcome back to our next session, community-based wastewater testing for SARS-CoV-2 in Yarmouth, Maine. My name is Becca Bolus and I'll be moderating today's session. Just a couple of reminders before I introduce our speakers. The first is that we are offering conference captioning services. Within the session, you'll be automatically provided with captioning, which is underneath the video stream. If you don't need the service, you can push the pause stop button and that will stop the stream. The second is please be sure to complete the session evaluation. It's just 4 short questions and your feedback is very helpful to us and to our speakers. And it is required if you're seeking continuing education credits. And so with that, I'm excited to introduce our speakers, Gib Parrish and Yolanda Brooks. And with that, I will turn it over to you.
Good afternoon, everyone. We will be discussing our community-based wastewater testing program for SARS-CoV-2 here in Yarmouth, Maine. As Becca mentioned, my name is Yolanda Brooks, and I am from St. Joseph's College of Maine. And with me, I have Gib Parrish, MD, who is part of the Yarmouth Community Coronavirus Task Force. And we would like to disclose that we have nothing to disclose regarding to commercial relationships. So what is SARS-CoV-2? SARS-CoV-2 is the virus that causes the disease COVID-19. SARS-CoV-2 is an RNA-based virus. What it does is the virus itself will attach the spike protein shown in purple to a receptor protein on a host cell, in this case, the ACE2 protein here. That is how the attachment of the spike protein to the ACE2 receptor protein will allow the virus to enter into the human cell and to replicate. The virus then can leave the body via feces and then also respiratory droplets. SARS-CoV-2 is transmitted from an infected individual to susceptible individuals via respiratory particles from the nose and the mouth to the mucous membrane of a susceptible person. In well-ventilated spaces, SARS-CoV-2 will travel between up to 5 to 6 feet through small infectious droplets. In poorly ventilated, crowded area indoors, it can also be airborne, and which means it stays in the air for long periods of time and travel via infectious droplet nuclei. Some of the riskier activities that increase the transmission include coughing, sneezing, talking, singing, and also heavy breathing. Molecular testing for SARS-CoV-2 is done on the individual level. First is the collection of a specimen from an individual, which is shown here. In the laboratory, that specimen is then the genetic material, in this case RNA, is extracted from the specimen. That RNA is then amplified via for genetic markers that are specific to SARS-CoV-2 in a process called PCR. That amplification allows us to visualize the presence of SARS-CoV-2 within the specimen. And if SARS-CoV-2 is present, or the genetic marker for SARS-CoV-2 is present, it is indicative of a COVID-19 infection. There are a few limitations for individual molecular-based COVID-19 testing. One of them includes the lag time, so the time between specimen collection and receiving results. That can be a large time frame, up to a couple days. The next includes the availability of actually being able to get a test. The next is also if there is a cost associated with getting an individual COVID-19 test. And then in the beginning of the pandemic, we saw, and then recently, supplies related to individual COVID-19 testing were in high demand. And then also the laboratory demand. If there is space in laboratories or personnel in laboratories, and then also just availability of laboratories to conduct individual COVID-19 testing. So the issues with COVID-19 testing, what we found out Since the beginning of the pandemic, or close to the beginning of the pandemic in February of 2020 up until now, we found out that about 24% of all COVID-19 infections were reported to the federal CDC. And we also found out just a little over half of all hospitalizations of COVID-related illnesses were reported as well to the CDC. This underestimation of the reported number of COVID cases means that the actual number of cases is a lot larger than what's being reported. And it also, the underestimation of COVID-19 cases that are being reported is due to lack of complete reporting. And then also not detecting the presence of SARS-CoV-2 within an infected individual. So one way to evaluate a community in terms of public health and health status is to look or to do surveillance of that community with wastewater. Wastewater surveillance is done at the wastewater treatment plant. And coming to the wastewater treatment plant are wastewater from various locations within the community, also called the sewer shed that is connected to the wastewater treatment plant. Those include buildings that could be hospitals and schools, it could be residents for individual families, and it also could include public places such as malls, schools, and also office buildings. So what happens is that all of that wastewater comes into the wastewater treatment plant in order to be treated. And we can look at the health status of the community by looking at more or less the wastewater that is coming in that is being anonymous, and it allows for anonymous evaluation of within a community, not just looking at individuals within a community. Wastewater surveillance has been previously used to determine transmission trends in hepatitis A, opioids, and also dietary intake. So currently, there are many communities around the world that are using wastewater surveillance to determine the presence and also concentration of SARS-CoV-2 in wastewater to evaluate transmission trends in a community. So what we know as of now is that COVID-19 infections, both asymptomatic and symptomatic, will excrete SARS-CoV-2, the virus, in feces. So this allows us to evaluate the concentration or assess the burden of disease within a community. Previous literature has determined that the presence of SARS-CoV-2 in wastewater was detected prior to recognition or clinical recognition of cases in both Europe and the United States. And we've also seen in various locations that increases of SARS-CoV-2 within wastewater preceded increases in reported cases. So this allows for communities to create early intervention strategies in order to lessen the burden of COVID-19 within the community. Currently, the federal CDC has a program called the National Wastewater Surveillance System. And this is being used to help monitor SARS-CoV-2 and its transmission within a community using wastewater surveillance. So the idea is that samples of wastewater are essentially a pooled test of many individuals within a community. It can be used to measure the presence and then also the concentration of SARS-CoV-2 within a community, and also look at the burden of disease in both not only asymptomatic, but also symptomatic cases. So one of the reasons why this is a public health tool is because it's non-invasive. You're not requiring individuals to do routine COVID-19 testing. And then with one single sample, you're able to look at the community, the health status of a community in one single sample. So that is why we consider it time and cost effective. And then it's also been used previously to evaluate or to demonstrate it's an early warning of the increasing burden of COVID-19 within a community. Within the state of Maine, there are various communities that have done or are currently doing wastewater surveillance. And those include small communities such as Farmington, Augusta, Brunswick, and Yarmouth, and also large communities including Portland and Westford, Gorham. Gib, you're muted.
Okay, sorry about that. Yarmouth is a coastal Maine town, 10 miles northeast of Portland, with a population of about 8,700. It covers the same geographic area as the Yarmouth zip code, and about 70% of its residents are served by the Yarmouth Wastewater Treatment Plant. There's a single wastewater treatment plant that serves Yarmouth. In March 2020, a citizen-led coronavirus task force was formed in Yarmouth to respond to COVID-19 as it began to spread across the United States. During the summer of 2020, several members of the task force began exploring wastewater testing for SARS-CoV-2. The Yarmouth Wastewater Testing Team, another citizen-led group, was formed to lead the effort to establish a pilot wastewater testing program in Yarmouth. The wastewater testing team worked with Yarmouth's town manager to identify funding for the program and with the Yarmouth Wastewater Treatment Plant to collect weekly wastewater samples for laboratory analysis. After reviewing several testing options, the testing team selected Yolanda Brooks of St. Joseph's College of Maine to analyze Yarmouth's weekly samples. An initial 6-month testing program was funded by the CARES Act and began with its first sample on September 21st, 2020. An additional 3 months of testing from mid-March to early June 2021 was funded by the town of Yarmouth and individual contributions. Next slide. The Yarmouth Wastewater Testing Program had several objectives. The first was to undertake a community-based testing initiative to complement other COVID-19 related activities in Yarmouth. All of these activities had the goal of reducing SARS-CoV-2 transmission. The second objective was to monitor COVID-19 infections in Yarmouth, independent of cases reported by the Maine Centers for Disease Control. The third objective was to evaluate the mathematical relationship between SARS-CoV-2 concentrations in wastewater and reported COVID-19 cases in Yarmouth. Next slide. Now you're muted, Yolanda.
Okay, so what we did, how we measured SARS-CoV-2 in the wastewater from Yarmouth. The Yarmouth Wastewater Treatment Plant collected 24-hour composite samples of the wastewater that was coming into the wastewater treatment plant. This wastewater was untreated. In a 24-hour composite sample, what it does is it takes a small volume of wastewater within intervals over a 24-hour period. So this wastewater was then graciously sent over to St. Joseph's College by a member of the Yarmouth wastewater, excuse me, by the members of the Yarmouth Coronavirus Task Force subgroup. At St. Joseph's, what we did is we concentrated the virus, and then we extracted the genetic material of the sample, and then we amplified genetic sequences that were specific to SARS-CoV-2, and we did both of these steps using the IDEX wastewater SARS-CoV-2 qPCR kits. Once we were able to get a quantity of SARS-CoV-2 in our sample, we then assessed that for recovery of the virus, as well as transfer that concentration of SARS-CoV-2 to a daily flow rate of wastewater coming into the treatment plants.
Yarmouth's initial 9-month wastewater testing program collected, tested, and reported the results for 38 weekly wastewater samples. As Yolanda said, each of these 24-hour composite samples was collected from 7 a.m. Monday to 7 a.m. Tuesday, with the exception of 2 samples that were collected on different days of the week due to holidays. The figure in this and the next 2 slides shows the wastewater testing results and the number of COVID cases reported to the Maine CDC for the Yarmouth zip code. And as I mentioned previously, the town of Yarmouth and the zip code area are the same, so they correspond. The blue dots in the figure represent the unadjusted results of each wastewater test for SARS-CoV-2 starting on September 22nd, 2020. On January 5th, 2021, the testing program was able to adjust testing results for wastewater flows through the treatment plant and for viral recovery during the laboratory analysis of each sample, which Yolanda explained briefly a few minutes ago. The red dots represent these adjusted results. The green bars represent the number of COVID-19 cases for successive 7-day periods, Monday through Sunday, as reported for the Yarmouth zip code by the Maine CDC. The yellow bars at the bottom of the graph represent Yarmouth school vacation days. Adjusted wastewater test results ranged from a low of undetectable to a high of almost 685,000 viral copies per liter, that's about a quart, of wastewater on January 26th, 2021. This value on that date corresponded to an average of 245 million viral copies per person per day in Yarmouth. That's a lot of virus. Next slide. Viral concentrations climbed during November 2020 and peaked in January 2021. This peak corresponded to the peak in the number of cases in Yarmouth reported by Maine CDC. Viral levels then declined and fluctuated between 8,000 and 60,000 viral copies per liter from mid-February until roughly mid-May 2021. Viral concentrations then dropped to undetectable levels during late May and early June, when our initial testing program ended. During the 9-month program, viral levels tended to increase following school holidays. Next slide. In response to consistently high levels of virus in wastewater and high numbers of reported cases during January 2020, the wastewater testing team prepared and the community task force disseminated community advisories on January 16th and February 2nd, 2021. The advisories warned Yarmouth residents about high levels of virus in the community and encouraged residents to practice appropriate non-pharmaceutical interventions to reduce viral exposure and transmission in the coming weeks. In other words, advise people to wear masks, do physical distancing, and to avoid close contact inside with other people.
Oh, sorry. Did I jump the gun?
Oh, that was perfect.
So what this graph on this slide shows, on our x-axis is the average number of reported cases the week during wastewater sampling in the week prior. And this is a log 10 of that. On the y-axis is a log 10 concentration of the viral copies of SARS-CoV-2 per day. What you see on this graph is an increase in reported cases, also is associated with an increase in SARS-CoV-2 RNA concentrations in the wastewater. Specifically, a 10% increase in SARS-CoV-2 RNA concentrations were associated with about 2.5% increase in the average number of reported cases the week of and the week prior to sampling.
So what have we learned so far from our wastewater testing program? First, even a small town can successfully establish and manage a community-led wastewater testing and surveillance program. Second, the Yarmouth wastewater testing program allowed Yarmouth to monitor trends in SARS-CoV-2 infection, and by extension, COVID-19 cases, independent of reported cases of COVID. Third, there was a strong correlation, as Yolanda just showed in the previous slide, between Yarmouth's wastewater testing results and Yarmouth's case counts. Finally, community wastewater testing can be a valuable complement to case data derived from individual testing in a community, as explained in some of Yolanda's initial remarks about the contributions that wastewater testing can make. Next slide, please. We have also learned that the wastewater testing program was valued as a supplemental measure to understand levels of infection in the community. In addition, the program provided guidance and comfort to the community that our town was doing its best to keep everyone safe. Finally, the community valued the information from the testing program so much that they were willing to personally contribute funds to sustain the testing program for an additional 3 months. Next slide, please. We would like to acknowledge the following individuals and institutions for their contributions to the Yarmouth wastewater testing program. Next slide, please. We're now happy to take your questions.
Thank you. That was so informative. I had known that you were doing wastewater testing, but I didn't know all the ins and outs. So thank you for presenting that. There are a lot of questions for you, so I'm going to do my best to get through them. I think we have time to get through them all. The first is, are you able to isolate results to Delta or other variants?
We can. We currently aren't.
Can you speak a little bit about how wastewater testing could be applied to other communicable diseases?
Sure, and then I would like to give if he has also any examples. So previously in Metro Detroit, they were able to demonstrate hepatitis A transmission using wastewater testing. And it's also been done for polio as well.
Mm-hmm. Yeah, those are two good examples that Yolanda gave of infectious diseases that have been monitored. There have also been, as she said in her earlier remarks, it has been used for monitoring certain drugs in wastewater as a way to try to determine, for example, opioid use in a given community.
Thank you. How did you account for the 30% of residents whose homes are not connected to city wastewater?
Well, we didn't. We know that there are septic systems that are off the sewage system that the wastewater plant has, but we are making the assumption that the 70% of houses, the 70% of I guess residents, as well as Yolanda said, businesses and other facilities that use the public system are representative of the whole population. That said, it's entirely possible that there may be some differences, and the more rural residences, for example, which are more likely to have off-system septic systems, might have had a different, different amount of infection from SARS-CoV-2 than the people on the wastewater system did. So it's an assumption that we've made. We have not accounted for it otherwise.
Thank you. So the comment is, this is very impressive, and it seems that the initiation and success was due in part to the volunteer task force and its members. How could other communities that may not have such expertise participate in wastewater testing?
I'll try and start on that one, and then Yolanda may have something else to offer. The state of Maine currently is, and the University of Maine are trying to encourage additional wastewater testing for mainly certain facilities, for example, schools, jails, and other settings where there's a fairly well-defined population. And they are funding wastewater testing for some of those places. In terms of other groups, other, say, towns, for example, that would want to do this, there are materials available on the CDC, the National US CDC's website, that talk about wastewater testing and some of the things that need to be done in order to set that up. Additionally, there are folks like us in Yarmouth who have had some experience with this and would be happy to talk with other towns about the possibility of doing this. And as Yolanda mentioned, there are several other towns in Portland as well as Westbrook that have also had wastewater testing and would have certain expertise too. So there's not a program currently set up that funds or provides direct, supervision or whatever to particular towns. But I think there's a lot of information out there now and opportunities to try this if you would be interested. Yolanda,
Yes.
anything to add?
Yeah, and then also as well, not only their companies, but also local colleges and universities. There are lots of academics who are doing this type of work as well that can be form partnerships with community groups.
Great, thank you very much. And just one last question that's come in. If folks are, for those who are listening in, please feel free to put any other questions you have in either the chat or the Q&A feature. The last question that I have here right now is, could you talk a little bit more about your process for getting city buy-in to do this?
Yes. As I mentioned in my early remarks, the Yarmouth Community Coronavirus Task Force was formed in March of 2020. And that task force had meetings with town officials. And we talked to them about what wastewater testing could potentially do. And we were able to sell them on it. There were funds available through, as I mentioned, some federal funding in particular that the town had received, and they were generous and offered to support the first 6 months of the testing program. So that's how we did the buy-in, was basically to talk to the town manager and anybody else that was needed and explain the situation. We also met with the wastewater treatment plant, which is essentially associated with the town, and came up with a strategy for doing the sampling that would be as little of a burden on the wastewater treatment plant as possible. So it was actually, we did not have a hard sell that we had to do. It actually went pretty well, and we were pleased with the ongoing support of the town and the wastewater treatment plant.
Great, thank you. Sharon chimed in on the chat to say that one very important point is to make friends with your local wastewater management people that can tell you how to fit this testing in with their routine activities. So, another consideration for folks. Well, we are at time, and so I want to thank again, Gibbon and Yolanda for being here today and for your presentation. We are very, very grateful, and thanks to everybody else who joined into today's session. Just a reminder to please complete the session evaluation using the feedback button. And we'll be back here in about 10 minutes for our last session, which is surreal to me that we're already at that point. And that session is Keep It Maine, Pandemic Communication, Rewards, Inspire, Evolves. And that will also be our closing session where those of you who have been participating in the challenge can learn who the leaderboard winners are. So with that, we'll close out this session and we'll see you back here in about 10 minutes. Thank you very much.